Hello everyone, welcome to AGRI-TALK. Today we're going to be talking to Karima about a new substance abuse program, so stay tuned, we'll be right back.
Hi, and welcome to AGRI-TALK, and glad you could be with us. Today we're going to talk to somebody that is leading some of the initiative to help people from being addicted to whatever, opioids or whatever. She kind of left it wide open as far as substance abuse. So we'll see what OSU and they are doing about that.
We have we have a guest with us, Karma, and apologize. Karima, yes, not Karma. Karima, can you tell us your title and so how long you've been with the university and such?
Sure, yeah. Can you all hear me okay?
Yes.
Okay, great. And I apologize for not having a live feed here. My webcam is not working properly, but you caught me on a bad hair day, so maybe it's a good thing. But
me too.
So I've worked with OSU Extension for a little over 7 years. I started my career as an FNEP program assistant. And for those of you who are not familiar, that's teaching low income and limited resource families how to eat healthy on a budget. And I was in Greene County, so right around Xenia, Ohio. And then during those 4 years, I went back to school at OSU and earned my master's in public health. And then that degree in public health really leveraged my work into research with food insecure families. So I was part of a program called Heal Maps, where we did some participatory mapping. So finding out how people access food with these handy little GPS units, and working in that capacity with the community got me really interested in community-based engagement, and that led me to this Prosper project. So some of you might be asking what's Prosper, and I'm going to try to share my screen here.
Mm-hmm. Now,
and let me know if you all can see that okay on your end.
Yeah.
Okay, great.
Okay.
So Prosper, just like everything at the university, is an acronym, and it stands for Promoting School, Community, University Partnerships to Enhance Resilience. So you might be asking yourself, what the heck does that mean? Mm-hmm. Well, just to give you some background, and some of you all, at least I would say all of us have experienced in some way or another the effects of the opioid epidemic, as we call it in Ohio. It's affected our entire nation, in fact. It's kind of is irrespective of your economic, situation, rich, poor, rural, urban, black, white. It's hit all of us. So Ohio, as you may know, is second worst in the nation for opioid overdose rates. We're second behind West Virginia. So our partners to the east have done a lot in trying to combat this epidemic, and you guys might have heard about in your own communities about like the Narcan or naloxone training, or about all the efforts that have been going into recovery centers. So there's a lot going on for treatment and recovery, but not a lot for prevention. So Prosper is a delivery system that focuses on the prevention of substance and opioid abuse.
So you're mainly talking to kids about not getting involved, or everyone?
Yeah, so that's a good question. So it's everyone. Prosper, and I'll kind of go through this, but it has a 3-tiered system where we have family-based programming, where we ask the parent and caregiver to come along with the youth to a 7-session program. There's a school-based component, which is delivering a program called Life Skills in 7th grade classrooms. And then there's a community-based component where we've got community teams that are comprised of maybe health departments, your drug courts, your extension offices, of course, your schools, that are all coming together at the table and talking about, okay, how does this look in our community and what can we do to help?
Now, is this in every county?
So that's a good question. I have a map
on
up
that
here on
map
the
there, it
screen.
had just
Yeah.
several different little places with different colors.
Yes, yeah. And I think there's one little edit to that. The one in the top northeast corner of the state, Stark, Mahoning, Columbiana, that little red sticker's actually been moved to Washington County. So we're mostly in the southeast with respect to Paulding and Hardin County. So the color coding there is just refers to like which pot of money we got funding from, so not really as relevant, but you'll notice that there's 9 counties: Paulding, Hardin, Greene, Brown, Pike, Benton, Perry, Monroe, and then Washington, all of which are classified as rural. And then we've got one smack dab in the middle, heart of Ohio, Franklin, so that's our urban county, also implementing.
So would like the Vinton County serve Vinton County, or would Vinton serve the surrounding counties around it?
That's I'm glad you brought that up. So it'll be just Vinton County, but that doesn't mean that they don't have folks from Athens and Jackson County sitting on their community team. But when I go through and talk about the structure of the Prosper delivery system, Extension is the backbone of that. So it's your organization that makes sure that all these efforts that Prosper is bringing forth is sustained within the community beyond whatever grant or funding period there may be.
Yeah, because I know Meigs and Gallia Pike are on the top 5, I think.
Yes.
In Ohio.
Yeah, and Scioto County was number 1 for opioid overdose rates for a long time, but they've done a lot of great things over a decade to really curb that. So
now, doesn't Dayton hold the number 1 spot?
Yeah, Dayton, same thing. As far as the metro area, they were really bad for overdose rates. A lot of that had to do sort of with how they're positioned and how trafficking was happening, drug trafficking. So it being right on an interstate, right at a crossroads, made it the epicenter for a while. But they've also been doing a lot of great things to curb some of the effects of it.
Now, this might be the $64,000 question. What works? Yeah, what do you see success with?
Well, I think they've just, do I understand that you've just started the program, or is it even officially underway yet?
Yes, we just started, and just to give a little more background, this was like, we got a funding opportunity, OSU Extension did, from USDA, NIFA, that's National Institutes of Food and Agriculture, through their Rural Health and Safety and Education grant. And so that was to fund 3 counties, and that originally was Hardin, Vinton, and I believe it was Brown. I'll have to go back and see. But anyways, once we got that, we were eligible for a couple other pots of money. So we've got funding also from SAMHSA, Substance Abuse and Mental Health Association, which is a national organization. We've got support from ODHE, Ohio Department of Health, as well as ROTA, which is a Rural Occupational Training program as well. So all of those, and we're also coordinating with a couple other colleges in the university. We've got public health and education and human ecology. So this has really become like almost like a, you got like a 2-legged race where you're trying to coordinate things. This has almost become like a 5-legged race with just trying to get us all on track. But you're right, Duane, that we're just starting this. We just launched our Strengthening Families program 10 to 14 in Hardin County. So actually today, this evening, I'll be traveling there to assist with the youth portion of that. But yeah, we're just in what we would call implementation of it. But what we hope to see is over the next couple of years, you'll see a lot of changes happening in the schools and communities as far as just awareness being built, the stigma around mental health being brought down, and just more coordinated efforts to help curb the substance and opioid epidemic we have in our state.
I guess the reason I asked what works is you said that certain counties have been doing a lot of good things that have moved them up or down. I don't know whether Dayton just got that much worse and got into the lead, or if Scioto did something to drop it.
Right. Yeah. There's a lot of factors. You're right, that affect where you fall on that ranking. Scioto, they also, because they were number one in the nation for a while, they got a lot of attention, and just like everything, it helps to have a pot of money to help make things happen. And so they were very well funded. They had great coordinated efforts, and really it's just talking to each other. I mean, for a long time you had the courts who weren't talking to the health departments, who weren't talking to the recovery centers, so a lot was lost in translation and communication, and so they weren't really able to have a coordinated effort until now. What you're seeing in Montgomery and even Hamilton County, Cincinnati, is a lot of quick response teams. So these are folks that are pretty much streamlining the process. And this model is just, law enforcement streamlining, collaborating with behavioral health professionals, offering care coordination. So really just the folks that are boots on the ground, talking to each other and working together in a collaborative way.
Now, there was a thing that came up on the Ohio ballot last November. I can't remember if it's called issue 1 or 2 or whatever it was, but I think it was like a way of decriminalizing it in a way, and
Oh, yeah. Yeah, I remember that.
below a certain amount of drugs you were caught with or had possession of, then it wasn't anything that they would arrest you for.
Yeah, it was something that you didn't necessarily get jail time for,
Right.
I think. You still
But-
got sentenced and fined, but you didn't.
It was a lot less.
Yeah,
It was a misdemeanor instead of like a felony or
Yeah.
something like that.
Right.
But the argument I heard from judges and law enforcement and people who are in the rehab facilities is if you can't arrest them, and by the way, that went down, so we don't have that. If you can't arrest them and have a way to twist their arm in a way, say, hey, you're going to go to jail,
Right.
or you're going to rehab, then nobody's going to show up. There might be like a percent or two that would seek rehab on their own, and without that, I know you can't arrest it away, but without being able to twist their arm with those things being serious charges, they couldn't get, a certain amount of people into those rehab programs. So that part, I know you can't arrest it away, but that amount does work.
That's right. Yeah, that was a real controversial issue, and I'm not an expert on that, but I know that, like you said, there was a lot of controversy around that, only because, there were things like, for example, fentanyl, which we know a lot of substances are being quote unquote laced with, or it's been added to. You don't need a lot of that to kill a lot of people, unfortunately, and so having minimum sentences for that isn't really fair. The argument was because even a small amount can cause a lot of harm. And
Yeah, they
you're
said
seeing
like just what you would have on those little needle heads
exactly
is enough to give an OD to like a law enforcement person that touches somebody.
correct. Yeah, that's correct, because there was fentanyl and there's carfentanil, which is about 100 times more potent.
Yeah, we needed that.
Just to give you an idea, it's just a grain of it can tranquilize an elephant.
Wow.
And that's what these substances were originally used as, were tranquilizers. So you're seeing this come up in opioids, which includes heroin, of course, but also cocaine and methamphetamine, which is also on a rise in Ohio. So we just, warn the public to be very careful. Depending on where you live, there are actually fentanyl test strips that some fire departments, law enforcement offices hand out. So there's a lot of effort being done at all levels to just educate the community, get the warning out, and almost just try to tame this beast that's kind of engulfed our entire state. What's unique about Prosper, though, is it really focuses on prevention. So before we even get into, the issue of addiction, how do we prevent our youth from even falling victim to this?
Mm-hmm.
So a couple of things, I'll just scroll through this really fast. What we're seeing with youth is, perhaps are failing to realize their potential. In addition to using substances, youth are more likely to engage in other risky behaviors that they may have been in the past. So you're seeing, and then effects of that might be suspension, dropout, arrests, and things like that. And then it's kind of a ripple effect from there. You see communities, of course, if you don't have a trained and able youth and workforce, you're going to see economic impacts of that. You're going to see, of course, incarceration rates increase, crime, and things like that. So we see these effects also affecting the communities that we live in. So I'll just go just quickly touch on some of these points, but I know we don't have a lot of time, and feel free you all to jump in with questions. But this strengthening families and promoting resilience is one of the ways to prevent. And when we talk about EBPs, those are evidence-based practices, like, as we know, the Extension Department really believes in. So we know that there are a lot of challenges, though. So what Prosper does to keep the burden of implementing such a large program is taking on a lot of that the work. So we make it easier for communities to implement these programs in their schools and in their communities. So it's
Karima,
been around
can I
for 20
interrupt there?
years. Yeah, go ahead, Duane.
So when you say it's you help them to implement this into their program, how is that done?
Yeah.
Are you a team?
Right.
Who's
That's a good
going to
question.
these places?
Yeah, it's really a 3-tiered system. So you've got state level partnership, that would be the Ohio State University and Extension. You've got the prevention coordinator, such as myself, functioning as a liaison, and then you've got the community team that's really doing the on the ground work.
And now, is that volunteers? Is that still part of the university people?
Right. Yeah, you're right. So you've got community volunteers, you've got schools, you've got folks who are working in libraries, recovery centers, health departments, law enforcement, all those people. Typically, you might have heard of like a drug coalition or a drug task force in your community. Those are what Prosper teams look like too, but they focus a lot on prevention. So really supporting this this programming, which I'll mention here in a bit, but it's the family-based programming and the school-based programming.
Now, I know yesterday I talked a little bit with you on another program, and a couple of the not volunteers, but the boots on the ground people, I'll call it. They were starting in schools and starting at a very young age, like 6th grade or something.
That's correct.
And,
so the Strengthening Families 10 to 14 program, like the name implies, really targets 10 to 14-year-olds. And I know that seems really young, and some of you might have kids that age, but that's really, research has shown that that's a formative time in an adolescent's life when they may be influenced by peer pressure, they may be getting mixed messages, they may even experiment with certain substances, and so that's where we want to intervene. So this family-based program, like you mentioned, Duane, encourages parents and caregivers to come to a session with their youth. And I say parents or caregivers because we know grandparents are taking care of kids, aunts and uncles, so we want to be inclusive. But they take part in this 7-session series, and it's 2 hours. The first half hour, first hour, I would say you've got parents and youth separated, where the parents are receiving a lesson about maybe, for example, love and limits, how to show love to your youth, but also set limits and have consequences for unfavorable behavior. And then the youth go through a different session where they talk about their future goals or aspirations, and maybe they make up a poster. And then the next half hour, we bring the youth and the adults together, and they talk about what they've learned, and then we share a meal together. So it's a really wholesome experience. Other things you learn in Strengthening Families program is perhaps how to have a family meeting. What does it mean to sit down and talk about, what's going on in the family, anything coming up? Maybe that's when the youth are asking permission to go to a birthday party or something, but like something as simple as a family meeting. And then youth also in these sessions learn how, when I encounter peer pressure, what can I do? What are the steps I take? And so there's actually a system called STOP, where they stop, think about the situation, tell the person who's pressuring them that they're not interested, and then so on and so forth. Mm-hmm. So really great tools that any family can use. If you don't have to be a family that's experiencing any type of issues, everyone has something to learn from this. So we just encourage in communities that we're working with to really reach far and wide and have an open door, and encourage anyone who may be interested, because everyone can get something out of it.
Now, I imagine prevention is a whole lot easier than trying to stop it after you've gotten addicted.
Yes, that's absolutely.
Much easier path to go.
Oh yeah. So when you're meeting with these kids and parents or grandparents or guardians even, is this a one-time meeting, or would it be a series and then you try to get new people each time?
Correct. Well, so the Strengthening Families program, I pulled up a screen that's more specific to it. Uh-huh. We meet for 7 weeks.
Okay.
So 7 weeks, and for example, in Hardin County, like today, we'll meet from 6 to 8 p.m. And then for 7 weeks, and that includes a graduation at the end of it. After that, the series is pretty much over. There are some follow-up activities, but it is a series, because that's when you get to see things like behavior change, and you get to see bonds being created with people, and mm-hmm. folks kind of come out of their shell. With the school-based program, we have teachers, 7th grade teachers implement that, and that is, it can be 12 weeks, it could be 18 weeks, they can combine lessons. It's really up to their discretion, but that has also lessons like, how do I cope with my anger? How do I handle my emotions? Things that we don't always learn in school, but we know adolescents need to learn.
Okay, and you have 2 programs there, the family and then in school. So you're also targeting the teachers to do it during school time, right?
Yes, that's correct.
And then the family one is after hours.
That's correct.
So,
that's correct.
And I can see that could be a huge commitment to different things, especially this time of year with springtime coming, with all the kids maybe wanting to do things out, mm-hmm. Sports and things like that as well, to try to get people to volunteer to do this.
Yes, it can be a challenge, and that's why it's quite the investment to take mm-hmm. on Prosper. Mm-hmm. But we want to encourage communities that we know that for every dollar that's invested in this type of prevention effort, you have a $9.60 return on the community. So that's that includes the costs that are associated with alcohol disorders related to lost productivity, treatment, law enforcement, the legal system. So you're investing in the future of your community, and that's what we really want people to know.
Gotcha. Do you see a lot of children or young people addicted? What would be a young age to be addicted? Would it be like 15 or 12?
Yeah. So what the average age and also sex of a person, it's typically a male in the early 20s, but that doesn't mean you don't have young people, elderly who may have gotten also addicted. You've got folks in their middle ages, folks that maybe they broke their leg in an accident and they were prescribed, opioid pain medication, and mm-hmm. they became addicted. And so you're hearing a lot about that on the news. I
guess the children probably pay for it in watching their parents or their caregivers be addicted, and them missing meals because they're passed out, or
could be whatever. Yeah. And it could very well be from school that they see some of the older kids, mm-hmm. Doing something so that to make it cool. they want to do it as well, maybe. Or,
Yeah.
hey, I want
Absolutely.
to be like that guy, be tough, or, or that girl or gal, who, whatever it may be. I could definitely see that. So,
Absolutely. You're right. There are influences from everywhere. So our efforts are really to intervene everywhere we can, help families become stronger and talk about the issue and make sure that the youth have the social supports they need. It's intervening at the school level. So any influence of a peer pressure there may be are being minimized. And also, again, at the community level. So these community teams, you've got folks at the health department talking about it more. Maybe when you go to the hospital, and you're prescribed something, they ask you like, hey, has anyone talked to you about tapering down your medicine? So just building this awareness, bringing down the stigma. It's everyone working together, everyone coming to the table. That's really is the only thing that's really going to work to recover from this kind of epidemic we've had in our state.
So you're the person that coordinates the people that work with the people, or are you one of those people that go out into the community?
Yeah, that's a good question. So as a prevention coordinator, this is kind of what that setup looks like. I'm in the middle there. So I provide a lot of technical assistance, but you've got the state management team. So that's Ohio State, the folks that do all the boring behind the scenes work and, have the checkbook and make sure, we're providing trainings and everything. But the community teams that are comprised of all those agencies, they're really doing the dynamic work. They're delivering these programs. They're coordinating, having these meetings with their coalitions. And so this is kind of what that state partnership looks like.
okay. And
Is there a way to ask for this? If you're in a community and you're concerned, is there a way to ask for help?
Yes, absolutely. I would say reach out to your extension office and see if they're participating in this. This is our first year, so we're kind of easing into it, but we hope to, and we are confident that we'll get some expansion funds and be able to really offer this throughout the state. But I have a website here up on the screen, helpingkidsprosper.org, if you're interested in learning more about it. But if you want to know if your community is taking part in these efforts, or you yourself would like to volunteer and be a part of this, reach out to your local extension office, and I'll share my information too. It's just let me see if I can write it on here. Let me know if it shows up. Let's see. So it's samadi.2, so SAMADI.2 at osu.edu. I apologize for not having it up on here, but yeah, definitely reach out and let us know if you're interested, and we'll be happy to share more information with you.
one last quick question. I know we're real close on time, but how long does this run? What are we anticipating? Or is this a year, 2 year, 5 year project?
Yeah, good question. So right now we're funded for 2 years, but we are confident, and we started just in the fall of last year. So we're looking at till the end of 2020, but we're confident that we'd be able to sustain these efforts, especially with the help of the local extension office and these community teams that are really tasked with going and doing some of their own fundraising to keep the efforts up and pay for these prevention programs. But there's a lot of efforts, even with our own governor, a lot of support being provided. So we hope to see it stick around, because it took us a while to get into this mess, so it's going to take us a while to get out of it.
I don't think there's much more that could be done in a positive way than to help the community by, fighting addiction and opioids and all that.
Trying to tackle a bad
Because
problem.
that affects so much.
Yeah. Mike, we're out of time.
Yep.
So, Karima, thank you very much for your time, and hopefully maybe we'll have you on another show and get us a little update on the project.
Absolutely, yeah. Thanks for having me.
And thanks to everyone for watching, and we will see everyone next month.